Good morning, Team Chesterfield. Welcome to Thursday and welcome to the last day of our 9-part series on town halls regarding returning to learn for the 2020-2021 school year. We appreciate you taking time out of your busy schedules to join us this morning. We have with us this morning the School Board Vice Chair, Dot Heffron, representing the Clover Hill District, and Mrs. Ann Coker, representing the Bermuda District. We have split this series of 9 meetings up over a course of 3 days, hoping to offer everybody every opportunity to join us, whether it's in the morning, afternoon, or evening. Each magisterial district will have held one of those opportunities at each time during the day. So each magisterial district, again today, is Bermuda and Clover Hill. This morning, we'll have had 3 different meetings. Just for those of you who haven't joined us yet, we are compiling all of the videos and all of the meetings on our website, mychesterfieldschools.com. They're also available on our YouTube page and Facebook if you are interested in going back and looking at any of the other discussions. Earlier this week, we did solicit questions from families online and staff as well. We're close to 1,000 questions received at this point. We've gone through as many of them as possible, at least the ones that tend to pop up the most frequently on these mediums. And so we're going to be back here today for 3 more, one at noon and one at 7 p.m. But we're going to start this morning with the Clover Hill and the Bermuda District. And so at this time, I'd like to introduce our school board chair, Dot Heffron.
Thanks so much, Tim. And good morning. Thank you for joining us for this important conversation. Today, Ann Coker and I welcome you to the 3rd virtual town hall meeting that we have co-hosted. The purpose of these community conversations that we've been having this week is to gather constituent feedback regarding Chesterfield's return to learn options so that we can adopt a plan for the fall that best suits our students and their families, as well as our teachers and staff, keeping in mind that everyone's health and safety is paramount. And while none of us could have predicted the impact of the pandemic this past spring, Ann and I are proud of our county's commitment to ensuring that learning continued. And we were especially impressed with how our central office team and high school administrators worked so hard to create meaningful graduation ceremonies to celebrate our class of 2020. Going forward into the fall, we are confident that our outstanding team of educators, administrators, and central office staff will continue that excellence as they plan and provide an engaging learning environment for all our students, regardless of what comes our way. So thank you again for joining us. Hearing from our community helps guide us through these tough decisions that we're facing. And no matter what learning looks like in the fall, be assured that we are committed to our students, families, and employees. Now it's my pleasure to introduce our superintendent, Dr. Merv Doherty.
Thank you, Mrs. Heffron. Before I begin, I would like to address an issue about our cleaning. And we are committed to making sure that we do everything possible to make sure our locations are healthy and safe. We decided to bring all of our district office staff back on Monday, and we have changed over some of our cleaning crews to do a better job. And the crew on Monday prepared the building. They cleaned the building, but they did not follow some of the new guidelines that we had in place. And this was a great learning opportunity for us, that what we assume people understand in the training. So I have a full confidence in Josh and his team of operations, but we've learned something which I'd rather learn now than 2 months from now. And that all of our facilities with walkthroughs and to make sure that there's checklists, the planning guidelines, and to assure each parent and community member, we will be posting our plans for cleaning of schools and the checklist that occurred. I would tell you this, I've been in the Hall Street District office Tuesday, Wednesday, and Thursday, and they have done a fabulous job of making sure this facility meets the standards from the CDC and risk management. So very proud of the quick turnaround time. I apologize to the district staff that they will be back next week, and we assure them that this will be ready. My responsibility is making sure that all of our students and staff are safe and healthy. And it's also my responsibility. When people want to praise us, that's great. When people want to look at things that we don't do correctly, it is my responsibility to make sure that they are corrected. And I want to assure you that we have corrected this issue. We are very confident where we're going, and we are going to be very public on how we continue to do this. So, Mr. Bullis, at this time, I am going to go ahead and do the presentation. And I promise. Okay, it's working. Well, we are glad to share with you our opportunity to teach our students again for the 2021 school year. I will remind everyone that this is where we are today. And if you've been following this pandemic at all, you will know that things change rapidly, if not day to day, week to week. So let us begin. Ms. Heffron, thank you for your opening remarks, and we will have an overview and acknowledgments of where we are. Also, the presentation of the options that are being considered, and then also acknowledgments of the uncertainty we have in the future and moving forward or even moving backwards, which we already see is happening in several states. And we're looking forward to the questions and comments from families as we can remark on them. So we believe in Chesterfield that face-to-face instruction is the best for all students. We want your child in our schools every day under normal circumstances. However, we also understand that things change quickly, that everything moves at a rapid pace, and that everybody wants answers right away, which sometimes are impossible. But we also want to say that safety is important for our students and staff. And we realize that there are families that want their students to return full time, and there's others who do not want to send their children back until we have a vaccine for the cure of this pandemic. But any decision we make, we realize that not everyone will be happy, but we will do it for what's best for our children and staff. The school board is expected to vote on the reopening option on a special meeting on July 20th. Just remember that everything we discussed today is as of today. And we are going to be flexible because we may see in different phases things change, and we will be able to adjust. That may help us open up the school even faster. But we will communicate with you as we have been regularly through our Monday, Wednesday, and Friday memos that go out, emails, and Facebook, and all of our social media. We rely on the Center of Disease Control and Prevention for information, the Governor's Office, Virginia Department of Health, Virginia Department of Education, and Chesterfield County's Risk Management Team, who they work with the Chesterfield County Health Department. Reviewing executive orders, looking at social distancing guidelines, which have changed rapidly. Also, the other health and operational recommendations that we have, and we know that additional phases will be coming. We are making sure that we talk to staff and students, the parents, the family members, community members, business leaders, faith leaders, all organizations possible. We've done surveys. We are continually reaching out to do surveys. We will end up with over 80 virtual meetings before we come back to the board meeting on the 20th. And we will do additional surveys once the board has made a vote and decision on the opening of school to find out for attendance, for transportation, and other information vital for us to open the school year for 2021. We know that individual family choice is important, and through our options to come in person or to have virtual learning is a decision that each family will make. We want to make sure that all of our students have technology and internet access so they can learn at home and do the work at home, even if they're doing face-to-face, to have opportunities to continue to grow educationally. The operational flexibility we have to have is how many students can we have on a bus? How many students can we have in a classroom? And the et cetera issues that the guidelines continue to move on us. Executive orders still require face coverings in public and also within our building. And we have to look at the grouping of students if we decide on the 50% model and what class schedules look like. The Department of Education in Virginia has given the sole authority to open our school year up by the options from the Chesterfield County School Board. And they are the only ones that will make the decisions on which option we will move forward with for 2021. And as we know that we are taking information daily from not only local boards, but also from local health departments, community concerns, and facility constraints that we have due to the guidelines that we are placed right now. And we do have the ability to deviate from the Department of Education's guidance with health plans and instructional plans. We do speak with risk management because they help us with safety and safe environments and healthy environments for our schools, and they follow CDC guidelines. They have reviewed some of our options, say 50% seems to be reasonable, but we know that in the middle of this month, the Department of Labor will provide a workforce guidelines that we will have to follow in order to open our schools up, as well as businesses will as well. We do require all of our staff members to certify that they are well through a self-assessment checklist. We know that we have guidelines to clean a room if a COVID-19 case occurs immediately, and the recommendations that we have and contact information, as well as cleaning the room immediately so it can be used. The guidelines right now require a student to wear a mask on the bus, as well as the guideline did change that if we have family members who are riding the same bus, that they could sit in the same seat. So we know that the options that we present to the school board to bring students back at one time, that's option one. But we do want to err on the side of caution, choosing to focus on the health and safety of nearly 63,000 students and nearly 8,000 employees. We will continue to remain aligned to the social distancing guidelines from the CDC, Virginia Health Department, and risk management. And we do not recommend things that will allow all of our students to come at one time to create an unhealthy situation. So here are our options. We have priorities, and the priorities are safety of staff and employees and students. We know that the students' social emotional well-being and our faculty social well-being is extremely important for us to address. Serving our most vulnerable students is important. Making sure we have equitable access to resources, have flexibility, and also communication to everyone. We are very concerned about the recovery of lost learning time and also new learning, and making sure that our staff have professional learning opportunities to prepare for this coming school year. With our most vulnerable students, the following groups would report every day face-to-face school is in session: all level 1, 2, 3, and 4 of English language learners, and all level 2 adapted curriculum students with disabilities. Option one, we would all love to see, but is returning all students every day. Remember, options 1 through 5 allow parents to make a decision whether to send their child to school or do virtual learning every day. Option 2 is 50% of our students attending school, which is every other day. The example here is you would come to school on Monday, have your coursework. On Tuesday, you would do the homework that was assigned. On Wednesday, you would come back to school with the work completed. We are making sure that in all options that we have, that attendance is taken every day, grading is occurring, work is being assigned, and our grading will be online for parents to review. Option 3 is a little different version where it's 50% of our students, but students would come on in school on Tuesday or Thursday or Wednesday or Friday, with Monday being a cleaning day, looking at staff development, and also individual contact day for students. Option 4 is a similar, but with a change of coming to school 2 days in a row and then off 2 days in a row. So Tuesday, Wednesday, you're in school. Thursday, Friday, you're doing your work from home, and it switches from Group A to Group B in the cohorts. This option 4, which we call option 4B, which is modified, has a similar, but it's Monday, Tuesday, with a Wednesday off as a cleaning day and contact and professional development, and then Thursday, Friday as well. Option 5, which is 25% of our students attending 1 day a week, Tuesday through Friday, and with contact of individual students on Monday. And option 6 is a virtual learning with the students in the building. We want to be prepared for whatever happens. 2 months from now, we could be in a phase 4, beyond phase, or revert back to a phase 1 enclosure. as we've seen now in several states that have moved too quickly. At this point, we know we're in phase 3, and we don't know how long we'll be in phase 3 of the governor's options. We do know that future phases will change capacity. Future phases will change the recommendations that we have. Our most viable options are option 2, which 50%, which is face-to-face every other day, and option 4B, which gives us opportunity to have 2 days a week of teaching, have a day of deep cleaning, and also professional development and contact with individual students as we go through. So, Mr. Boss, at this time, I'm finished the presentation, and I will turn it back over to you so we can answer the questions from our community and continue to move forward.
Thank you, Dr. Doherty. I appreciate that presentation. You've got it down by heart now on day, meeting number 7. So the presentation keeps getting better and better. As to which we're going to get right into in just a minute, but I did want to remind everybody that we're continuing to accept questions. The pre-submitted questions that were available through the Google Doc earlier this week. We also pull questions from YouTube and Facebook as we go along throughout this process. I already have about a dozen new questions written down on my sheet right here that had not been pre-submitted but have been submitted this morning. So we'll be weaving those into the mix as well. Before we get into that, did want to ask Mrs. Heffron or Mrs. Coker if they had any initial impressions, reflections, observations based on the presentation and or what you all are hearing from constituents so far.
Thanks, Tim. And, I too feel like I could memorize that presentation myself. Thank you, Dr. Doherty. I'm really looking forward to the questions. It's been really interesting this week to see how the conversation has developed. And, I've really appreciated it, and I'm looking forward to hearing from folks this morning. Anne?
Yes, thank you. Thank you, Dr. Doherty, for that presentation and the update. Again, third time around. I am very happy that we've been able to do these town halls. I think it's important that we continue to listen and get questions and feedback from our constituents. And I'm also very grateful that we have a lot of options that we have been exploring. So as we kind of navigate these next few months, if we need to revert back to any particular option, we have everything already laid out and can do so fairly quickly. Again, we are going to continue to take your questions and get information out to you as soon as we can. And I look forward to finding out what new questions we have today. Thanks.
Thank you, Mrs. Coker. Before we get started, we ended last night's meeting with a couple of thoughts, and I want to start off this meeting with the same thoughts and maybe end them there as well. There are a lot of anxious people, ourselves included. As staff and as school board members, we all have children in the school division as well. We all have a vested interest in this school division. Nobody on this conference call today or listening in created this situation. Nobody is to blame. We're all trying to pull in the same direction so that we can support our students, our staff, and our families. So as we go through this process during the next 90 minutes, we'd ask for grace and patience. We didn't create this mess. You didn't create this mess, but we're all trying to find reasonable solutions that can support our students, our families, and our staff to the best of our abilities. And so we hope that you will bear with us, and we will do the same with you all, because we know it's just as frustrating from the parent side as well. And so with that, let me introduce our folks who will be answering questions today. You've already met our superintendent, Dr. Doherty, who did the presentation. We have with us today our deputy superintendent, Dr. Thomas Taylor, our chief academic officer, Dr. Sharon Pope, our chief of schools, Dr. Lisa High, and our newest team member on this group, our chief operations officer, Josh Davis. Mr. Davis, we're going to go ahead and get started with you because we know that you have a prior commitment as well that we need to make sure that you make. Let's start and go back to the cleaning situation. Dr. Doherty was very gracious and very upfront with one of the challenges that we found this week. Can you walk us through what cleaning looks like in a school right now and what children and staff should expect to see when they come back in?
Yeah, thank you, Mr. Bullis. I appreciate the opportunity to chat with the community this morning. And again, appreciate Dr. Doherty's remarks, which I would like to expound upon a little bit. The safety and health of our students and staff remain our number one priority when we reopen schools. And there's some buildings that are beginning to open now. We have exercised and put together some of the plexiglass type of shields that have been sent out to schools. So there'll be, when folks are interacting with the public, we'll be able to have that safety device kind of between our employees and the public when they come in. But more specifically, we're cleaning our buildings every day, and to keep them clean is a combination of resources and labor and strong management. We have some guidelines that we've issued out for our principals, building leaders to be aware of. I'm going to share a few highlights from those. We're going to make some of this actually the whole document is going to become public. We want everybody to understand the direction that's been given. The resources include things such as soap, hand sanitizer, cleansers, and chemicals, and even the mops and sweepers and scrubbers that we have for our floors. And so we're going to obviously spend some money to put those resources in place, but the manpower is very important, and I want to chat about the manpower and their management. At each school have day porters that work under the supervision of the building operations supervisor and the administrative team. And the direction to those day porters, of course, is they're going to wear PPE. They're going to be very visible out in the school all day. They've been asked to disinfect all touch points and workspaces, sanitize all eating areas, all of these things a minimum of 4 times a day. Restrooms that are utilized by the staff or school occupants, we're talking those in the hall and those in our classrooms, should be completely disinfected from top to bottom, including sweeping and mopping 4 times a day. They're going to need to check and restock our soap dispensers. They're going to be visible. They're going to be out there addressing the touch points and cleaning in areas where we have occupancy, where folks are going in and out. Each day porter is going to be assigned a specific area, and we're going to try to have them rotate into multiple spaces so that they're, again, not only visible, but covering the entire building. And we mentioned the hand sanitizer. We're adding stations at the schools in our high volume areas, and these folks will be responsible to check and restock those stations 4 times daily. Again, we've identified 3 separate chemicals, one of which is used to disinfect our touch surfaces, another to disinfect food contact surfaces, and a third chemical to be used on our glass cleaners and floors. The staff needs to make sure that their carts are fully stocked. We're going to have those resources in place. But now the management piece is very important. And we did learn a tough lesson. When we tried to open our central office at CTC Hall Monday, we provided all sorts of direction. We as managers put the resources in place, but unfortunately, some of the things that we expected to be in place were not done by the personnel. So that tells us that we need to be even more diligent in our inspection when important dates are coming up. And frankly, once school starts, every date's going to be important. So another thing that we're going to share with you is our management structure, the supervisors that are going to be not at their central office working at their desks, but that are going to be out at schools working to ensure that building operations supervisors and that their day porters have the resources, and they're going to inspect. And that we need to ensure that we think things are satisfied and satisfactory. We don't want to have all of a sudden an overwhelming chorus of complaints from a group of students or employees that the job's not being done. We want our managers to do inspections, to understand where shortfalls might be taking place, and to address those shortfalls. The labor situation is going to be one we have to keep an eye on. We do have backups. We have what are called our floaters. And when we have the inevitable absenteeism amongst our custodial staff that work in buildings, our floater staff's going to have to be out there, and we're going to need to manage those folks wisely. The final group of employees that I'm going to mention are our contract custodians. Chesterfield has used those folks to work in afternoons and evenings for the last several years. We have a strong team of vendors, multiple companies that assist us with this, and we appreciate their support. But again, they have important work to do after the kids go home in the afternoon and in the evening, and when we have events that take place in the evening to ensure that those buildings are ready to go the next morning. So again, those are all the resources. We're going to really focus on, again, the management, and we're going to share a public document so that the public understands what we're trying to accomplish every day. So I appreciate the question, and we're going to continue this dialogue with our employees and with the public as we get closer to starting school.
Thanks, Josh. Let me ask you to follow up on one thing. Lindy just asked on one of our in one of our chat rooms, what about the student bathroom sinks? Will the water be set to a warmer temperature and run longer? How have we addressed that moving forward?
Yeah, frankly, I'm not real certain of how that plumbing works, so I don't want to make a promise that I don't necessarily deliver, but I'll be happy to check into it. I know the bathroom sinks that I use, just have the kind of the lukewarm standard water that comes in. So I know there's hot and cold, and that was another thing that occurred at CTC Hull on Monday, was that there was a little bit of there's a flaw in the hot water system. The hot water eventually came in our kitchens areas, but I'm not even sure that it's programmed to go to bathrooms. There's a single faucet, so let me come back, and again, that'll be something we'll share with the public, so they'll have an understanding of the temperature that we can expect in sinks, and the whether it's a kitchen sink, but more likely the sinks where folks are going to be washing their hands multiple times a day, and that might vary from school to school because our buildings have different generations of resources in place. But thanks for that question, and we'll address it.
All right. Now, just speak from personal experience in the past 2 days, the water has gotten significantly warmer. So thank you for that. Let's quickly bump over to transportation real quick again, wanting to make sure that you make your next opportunity on time. Can you talk a little bit about what we're going to do regarding cleaning on buses, and then what transportation will look like? I know that as the distancing guidelines have been not eased, but changed a little bit, it looks like we may be able to accommodate more students on a bus than we were originally thinking.
Sure. We can kind of pivot from the cleaning discussion because, we talked about all those folks that are responsible, and in many ways, though, all of us that work for the school are going to be doing perhaps more cleaning ourselves, whether it's the individuals leaving a conference room at central office, needing to wipe down their areas for the next group, or, teachers having to be a bit more active in the classroom. But the bus drivers are one that it's not necessarily in their job description to disinfect a bus twice a day, but that's going to be the fact of life now. Obviously, they've been charged with keeping neat and tidy buses, and they sweep the buses daily and so forth. But now we've got a new challenge, and they're each going to be issued a dispenser to put a spray, a disinfecting product on all of the seat surfaces, and they'll then handle the high touch surfaces too. And that's going to happen twice a day at the end of the morning routes and into the afternoon routes. We talked to risk management about transitions because, one might ask, why don't you disinfect the bus after each group of students? Well, that obviously would take some time. And risk management talked about that, and in our secondary classrooms, we have the transition from one group of students to another. And, do we need students in the hallway for somebody to come in and disinfect each classroom? Well, frankly, it's not practical, and risk management didn't think it was necessary. So by the end of a bus run, we're going to have those folks spray down their seats in all the common touch areas. And so that's going to be, again, extra work for our bus drivers. Now let's move on to how's transportation going to be managed and organized. So it's a finite resource, and it's going to be constrained. Chesterfield has had difficulty meeting our transportation requirements in recent years. We've got 40 to 50,000 students that have wanted to ride the bus every day, and that takes the resources of the buses and the drivers, and it's not easy to put all those resources together and to plan efficient routes. So now we've been told the first guidance from the state was maintain 6 feet of social distancing on school buses. And that was, I'll be frank, a little flabbergasting, because I immediately figured that out. That's a driver and 4 kids behind him and that on the driver's side and 5 kids on the other side on the passenger side when you space them out. 9 students, we really can't effectively transport with 9 students on a school bus because the demand is going to be far greater. So again, chatting with risk management, we believe that we can safely transport with 1 student in a seat, perhaps in a checkerboard pattern, 1 student next to the window and then the next row next to the aisle and so forth. And we can put siblings together in an individual seat. And so hopefully our capacity will be closer to 25 to 30 students on a bus. That's far less than what we normally do with as many as 50, 60, 70 elementary students, 40 or 50 secondary and middle and high school students. So these runs will be restricted to smaller numbers of students. We are looking at, however, the alternatives where only 50% of the students are coming every day. So that will allow us to have a reduced demand, but we really need to totally understand that demand. In the past, some students have either walked or driven their own cars if they're high school students, or the biggest mode which assists us is parent transportation. I would normally stand here and tell you that we want everyone to ride a school bus because it's the safest method of transportation. However, these are different times. And we've got families telling us that they would love to get their kids back into school and they are willing to transport this year, even if they haven't transported in the past. So we're going to be providing a way for families to communicate to us in the very near future what their desired mode of transportation is. So hopefully getting that input from our community will help us really understand the demand so Dr. Fry and his team can put together routes that will enable us to transport those students that really need transportation. We want to focus our resources in the area where they're really needed. And we want parents to understand that if they tell us they can move to parent transportation, but their situation changes, let's say in November, that they can then still come back and request bus transportation. This is not a decision that's necessarily locking them in for 180 days. Going to be challenging. We're going to do the best with the resources that we've got. We do understand that not everybody's going to arrive at school in a 10-minute block, but we're going to understand that staggered arrivals, some buses may be making double runs where they pick up one group of students the farthest away from school, then double back and pick up another group of students that live close to school and hopefully do a short run in 5, 10, 15 minutes. At the parent drop-off point, y'all wanted me to chat about that, so I'll continue on. The opportunities hopefully exist to spread that out in regards to having multiple points in which staff can greet students and help them out of the cars so that we can move that line along efficiently. If we've got 100 or so vehicles arriving at the same time, that spells congestion that could spill into our neighboring roads. So we will have different lines, one might say, or routes within parking lots where we may be snaking parents through a parking lot just to get those vehicles off the road. So be looking for that guidance. We're going to need help from our partners in public safety and the police, whether it's to address traffic in front of schools, to help students maybe with, or train some crossing guards to help some of our walkers. So a very complex operation, a lot of planning to take place. We'll appreciate the feedback that we receive from our parents in regards to their transportation desires.
Thank you, Mr. Davis. One last question that maybe will turn into a recommendation as we put out the cleaning guidance and share with parents. Kayla has asked, and I don't expect you to know this off the top of your head, which is why I'm suggesting maybe it can go in the cleaning guidance that we share with parents. But Kayla's asked what cleaning chemicals will be used. She wants to make sure that they're safe for kids. So can we put the names of the cleaning chemicals that we're going to use, the approved chemicals that we're going to use into the parent communication as well?
We sure will. And I've got the document in front of me. I could recite these, but I think just having them available in our public document, there are many documents products that have been approved by our government agencies for use in disinfecting that are very safe and that will handle the COVID virus if in fact it's been spread. And so we will share the names of those chemicals publicly and include links so that folks can see the certification that's been provided by our government authorities. So great question. It's something we want to be transparent about.
Great. Thank you, Mr. Davis. We appreciate you joining us this morning. We know we have another opportunity to get to represent the school division. So at this time, we'll say good morning to you and thank you for your help.
Thank you, Tim.
And with that, we'll start switching over to some of the safety concerns and instructional questions that we've received so far this morning. Chris has asked, and he says it's the fifth that he's been to, and he hasn't gotten his answer he hasn't gotten his answer yet. So let's take care of that right now. He wants to know when the results of the parent survey will be available, and I'll take an initial stab at that. And maybe Dr. Pope, if you feel like you need to jump in at the end. The survey is actually still open. It is open through the end of today. At that point, our research and evaluation team will begin to disaggregate some of the data and put together some responses to that. So, Dr. Pope, is this something we may be looking at the July 20th meeting as well, or might it be available before then?
We are aiming for the July 20th meeting at the latest, Mr. Bullis, and we're hoping for before. Again, that notion of don't overpromise and underdeliver. We have had such overwhelming response from our parents, which we truly appreciate, that we want to be sure that our statisticians have the time to do the job that they need to do. And yes, to your point, that survey is closing today, so we couldn't even begin that compilation up, previously.
Thank you, Dr. Pope. Next question has to do with whether or not we'll be requiring temperature checks of either students or staff. So I'll start and hand off to Dr. Taylor, if that's okay. Earlier this week, over the weekend actually, we provided guidance to staff, all 8,000 of our Chesterfield team members here, regarding self-assessments that they are required to undertake before they come back to work. And that's before they come back to work each day. There's a series of questions that they have to ask themselves about how are they feeling, what have they been exposed to, and ultimately they have to take their temperature before they come into work. Each employee is required to sign off that they will do that on a daily basis. That's now a condition of their work. So we've looked at that from that angle. Dr. Taylor, what are we looking at regarding students, and who are we actually getting our guidance from? And I'll tackle you can tackle the American Academy of Pediatrics question that's out there as well.
Sure. Thanks, Mr. Bullis. First and foremost, and this is going to be a theme that folks that have tuned in from time to time have heard before and will hear again. We would love to say that instruction is our number one priority. The reality is that safety of students and staff is our number one priority, and that instruction is our number two priority. Another theme that you'll hear time and time again is our emphasis on Maslow's before Bloom's. And basically what that means is that we focus on Maslow's hierarchy of needs. So throwback to your college or high school psychology class, where we focus on the basic needs of our children as human beings, the need for shelter and for their physical needs, as well as their social emotional needs, before we transition to their instructional needs, and that would be Bloom's taxonomy. So with that, we are focused on safety, and we are receiving our guidance, as Dr. Doherty said during his presentation, from the Center for Disease Control, which has a mandate to stop this pandemic and other infectious diseases from spreading. They are also working in conjunction with state health agencies, the Virginia Department of Health in our case, and they are our governing body, so to speak, our regulatory agency, taking those guidance elements from the CDC and translating them into practice in the Commonwealth of Virginia. The governor's office also is sending cues about expectations to protect public health, and how that relates to public education is translated through the Virginia Department of Education. The Virginia Department of Education just recently released a several hundred-page document. It's our 2020 Recovery of Learning and Reboot Plan, which tracks the phases of the governor's re-entry into the economy and what guidelines school systems should follow in order to maintain safety. As Dr. Doherty mentioned in his presentation, all of our recommendations at this point track with what life would be like if we were to reopen in a phase 3 environment. So as some of that guidance might change in the future, or as new guidance is created for a potential phase 4 that doesn't exist yet, or any other potential loosenings or constrictions to that phased approach, that may change our direction in our guidance. Back to the main point of Mr. Bullis's question, and I'll tackle this in two parts. The first part being the American Academy of Pediatrics. As I am not a medical doctor and none of the folks on this call are, we are very grateful for our pediatricians for chiming in and sharing their thoughts. That information is very helpful to us in helping us assess. We do rely on experts in our community to help give us guidance because we are not medical practitioners. We are educational practitioners. But their mandate is definitely focused on the welfare of our children and does not take into consideration our staff and the needs that they have as well. So we are balancing a lot of this information and definitely have shared the American Academy of Pediatrics information with our health department officials so that they can incorporate that into their guidance back to us. We work very closely with our county risk management group, who takes all of the guidance that we're getting from the Virginia Department of Health and the Virginia Department of Education and translates that into tangible practices that we can put in place in the school system. So all of our guidance that we're receiving from these outside agencies and even from our internal agencies has a mind and a focus on how we can open successfully for the most kids possible and still do so in a physically safe and emotionally and socially safe environment. So to the main question that was asked and that kind of kicked all of this off is we actually do not have a requirement in place that in terms of taking temperature checks of students as they're entering the building. We will be asking parents, much similar to what we are asking our staff members to do, which is to do a health screening and a health self-assessment each morning before you come into the schoolhouse. Should a vaccine ever be made available, this is something that would involve state law before we would require students to have some sort of vaccine or some sort of shot or treatment. That's not something that we would require or recommend to the school board that they require without some sort of state law to support that. We do believe that the self-assessments and the self-screenings that each family and each employee does in the morning will help considerably and also protect privacy of individuals in addition to helping us efficiently get in and start learning when we're ready.
Thank you, Dr. Taylor. And I just want to have you reaffirm something that you said, because Gretchen's written in that she's frustrated. We're just not opening schools, period. And she's wondering why education and science can't be the guiding principles instead of the media-driven misinformation. Just to reaffirm, we're relying on the medical guidance and the experts with Centers for Disease Control, the Virginia Department of Health, all regulatory agencies that are designed to provide such guidance to public government, local school divisions, correct?
That's correct. And I'll just re-emphasize a couple of points here. The Center for Disease Control does have a mandate. That mandate is to stop the spread of infectious disease. The Virginia Department of Health also has a mandate, and that is to provide for the public health of the Commonwealth of Virginia. They are issuing guidance in their medical wisdom that is to keep our community safe and to stop the spread of any infectious disease, and in this case, COVID-19. So we are taking our cues from experts. This is definitely reflective of our lack of expertise in the medical field, but definitely coupled with our expertise in the education field.
Thank you, Dr. Taylor. Last question for you before I bounce over to instruction is I assume that we'll be, Carrie has asked about mask wearing and following guidance on that. I assume that we'll be following the guidance that is provided by the various regulatory agencies for that as well.
That's correct. Any recommendation that we bring forward to the school board for their consideration is going to mirror the guidance that's paired up with whatever phase we are planning to enter school in. Again, right now, we're tracking for phase 3 because that's where we entered. We've been in phase 3 for a whole 28 hours or so. And should that change or be upgraded or downgraded at any point, our recommendations will have to be fluid and be modified to adjust to whatever phase we are in at that time.
Thank you, Dr. Taylor. Let's transition over to instruction. We're at about our halfway point. And so since teaching and learning is our second job after keeping people safe, let's move to that because there have been a lot of questions about what will this look like in the coming school year. So Dr. Pope, I'm going to ask you first. The first question, I'm going to put two of them on your plate at the same time. The first question is, will virtual learning be an opportunity to anybody throughout the year? Are we requiring students to come back to school if we open school? And number two, what exactly is virtual learning? What should parents expect? What should students expect? What does it look like?
Okay, great question, and thank you for that, Mr. Bullis. Good morning, everyone. Thank you for joining. For those of you who have listened to several town halls, you'll see or hear some repetition in this answer, but never hurts for our first-time listeners to take it from the top, as we might say. So with virtual learning, the first part of your question was, will parents have an opportunity to make a choice to go 100% virtual? And that is how the question is often being phrased as it's presented to us. And we want parents to have that choice because we understand that we have an entire community and people are at very different comfort levels right now. So we're trying to honor that and honor the voices that we're hearing through these town halls. Parents will have the option for elementary and secondary students to make the decision that they would like to keep their child learning remotely, not sending their student into a school building. And we're asking that parents make that decision in 9-week or semester increments, because with every student taught, there is an associated staff member assignment. Staffing and student rosters go hand in hand. So in fairness to our teachers and to our overall system structure, we really cannot have the flexibility to the extent that a parent might decide on a daily or a weekly basis to send a child to the school setting inside a classroom or to keep a student at home. So that will be a commitment and a decision point for our parents that will extend throughout next year and will be made in at least 9-week or semester increments. So we will be, of course, communicating more about that as we get closer to the decision point. And that decision point, of course, will follow the July decision by our school board on the models or the options that Dr. Daugherty has presented, because parents will need to have that information as they make the decision. Virtual learning for us, the way we're defining it in Chesterfield, because there's so many definitions out there for so many different terms related to the different learning models right now, simply means that the child will remain outside of the school setting and continue learning new instructional material next year. A CCPS teacher will support that learning. A CCPS teacher will help with goal setting, progress monitoring, communicating to parents, successes in areas where a student will need to focus in more. We'll deliver a specific instruction when a student might struggle with a content area or a concept area. And there will be, for our elementary school students in particular, a different structure than we would expect with our secondary students that remain 100% virtual. We know our secondary learners can be a little bit more independent, but for our youngest students in our school system, we feel that it will be important to have a mix in that virtual learning experience of some synchronous and asynchronous learning, which is just a fancy way of saying that there'll be a set schedule and the teachers will be connecting with the students at particular times of the day. For example, in elementary schools, we feel it's really important to have a morning meeting where all the students in the classroom with the virtual teacher would join together through their devices that we're providing as a school district. They would have that touch point, that moment, talk about the day, talk about some of those social and emotional learning concerns that we have, just a check-in for students before they launch into spurts of face-to-face through a device and online learning applications. So there would be an in and out. We certainly know that our youngest students cannot sit in front of a screen for extended periods of time. So that structure in that day would look different for our youngest students, but it will be an option and it will be explained more thoroughly with kind of a day in the life described in a video to parents as they make that choice. Mr. Bullish, you're still muted.
There we go. Thank you. I'm going to stay with you, Dr. Pope, for the next question. We've got a handful of parents asking about services for students with special needs. What will that look like? What will that look like? How will we address IEPs? And will the IEP meetings be done prior to the start of school?
So absolutely. Our IEP teams are the best source to make a decision for each individual student, because that team always involves a parent or guardian, and as well as school personnel who best know that student and what that student's needs are. Our IEP teams will make decisions about student services for this coming year based on whatever approved district option the board determines is our best way forward in July. So yes, IEP teams will be meeting and they will be looking at questions such as whatever the social distancing limitations or restrictions may be. Will this particular individual student be able to comply and meet those restrictions, whether it's 6 foot or wearing a mask, for example? The team would also look at accommodations and modifications and how can we best stretch whatever option we're working under, whatever restrictions have been imposed on us by a world pandemic, to continue providing learning with the most support possible in the situation to students. IEP teams will have a lot of work to do after that July decision point with our board, because knowing that model will be critical in their decision making.
Thank you, Dr. Pope. I'm going to go to Dr. High next, and Dr. Taylor may chime in on the last part of this. Carrie's written in making sure that we're providing equitable services to our low income families. So Dr. High, if you can talk a little bit about what we're doing to make sure that everybody has technology access this year, as well as the supports that we're going to reach out to the daycare communities to offer. And then if Dr. Taylor or you, depending on whoever wants to talk about meal service delivery, understanding that children will still need 5 lunches a day.
Yes, thank you. In terms of technology, our goal is to be pre-K-12 by the start of school in September. In March, when school ended, for face-to-face, we were 5 through 12. Since then, we have worked with 2 through 4 to get devices in the hands of students. We are working with our technology department to order devices, Chromebooks for every student. Another component that we're focusing on is access. We know that there are families who do not have access to get on the internet. So we are working with Comcast as well as ordering hotspots to support families who meet the certain criteria to be able to have that access to the internet. We are very much aware that there are some locations that Comcast doesn't provide services. So we will ensure that those individuals who wish to have internet receive a hotspot. Dr. Daugherty has gone out and worked with our community partners to get funding to support and offset the cost of that. So, we just really applaud all the work that the Education Foundation and Dr. Daugherty are doing to support our families.
And I'll chime in on meal service. It is our intent to continue meal service no matter what schedule we are on. We will continue to provide meals to students who need them. A big shout out to our school nutrition department and our very hardworking nutrition workers and their leader, the director, Pearl Taylor, for doing a great job this spring. And this summer, over 1 million meals have been served to our children in need in this community. For folks who don't know, who are watching, 40% of Chesterfield County students are eligible for free lunch That's a federal meal program, and we do provide meals to our families even when we are closed. We're exploring a number of options on how this will look. We have not finalized what this will look like precisely, except that we know that we can guarantee to our families that this will be something that is available to them as we get into the fall and into the school year. One option that we've looked at is grab-and-go kiosks in our school vestibules and in our school entrances, and that's going to be a target for us to look at as we go into the fall.
Thank you, Dr. Taylor. Next question, I'm not sure if this will go to Dr. Pope or Dr. High, but Laura has asked about how will we decide who teaches what in terms of virtual learning and face-to-face learning. So what are our plans for supporting virtual learning and who would be assigned to that?
So first and foremost, just as we're trying to provide choice to our families that best fits their comfort levels, we know already that we have teachers with different comfort levels as well, Mr. Bullis. And so we do have teachers already expressing to us that for a variety of personal reasons, they are interested in continuing to be a 100% virtual teacher this fall. It's a delicate numbers game because until we ask our questions of our families later in July to ascertain how many will want to take advantage of that 100% virtual option, we're not sure how many teachers we will need. At the same time, we have teachers who are raising a hand and saying, I love this, or for other reasons, I feel like this is what is best for me and my family at this point. And just as it's always a jigsaw puzzle every year when we work with staffing for our schools and making sure we have the right number of teachers in the right buildings for the right number of students that we're expecting, it will be even a more complicated jigsaw puzzle this time around. So we feel we have the teacher interest, and it is going to be that numbers game later in July or early August just to get it to all mesh and work out well so that we can serve all of our students. But it's certainly something that we're thinking through and considering how best to make that happen quickly for our staff who need to know and for our parents who want to take advantage of that option.
Thank you, Dr. Pope. The next series of questions really gets into some of the individual options that have been proposed. Folks are really diving deep into those and have some questions about it. So I'll defer to Dr. Pope or Dr. High or Dr. Taylor, whoever would like to jump in on these. Yvonne has noted that the split scheduling that we are proposing somewhat limits teachers to 1 day a week in terms of being face-to-face with their children or with their students. Are we looking at any other options, or would we be open to any other options that would allow them to, at the secondary level, work with children more than 1 day a week?
There are, at the secondary level, a lot of their learning on depending on which schedule we choose, on the options 2, 3, and 4, when students are in 2 days a week, they may operate and see smaller chunks of their scheduled day in terms of their class period. There potentially would be smaller increments of time where they would visit every classroom. There could be where we're doing 3 classes one day, and the second day that they're coming, it would be the other four classes on the 7-period day. But that's something that we're working with our principals in schedules. They actually have 4 different options that they're looking at and playing around with to see which one is going to best meet the needs of all of our students, to include our CTE students and our specialty programs and so on.
Perfect. Thank you, Dr. High.
Screen keeps freezing, so I'm not sure if you can hear me because everyone keeps freezing.
We got your answer. It was good.
Okay.
I'm going to bounce over to Dr. Taylor real quick. Aligned with the scheduling, as we deal with this uncertain time, lots of rumors and misinformation start to creep up, and we've gotten a number of people this morning and over the last year have asked if we are moving to a 4x4 schedule. Where are we with that? And can you define what that is?
I'll start with defining what that is, and I'm delighted that this is one more opportunity to put that rumor to rest. A 4x4 schedule is typically administered at the secondary level, and it's when students take 4 classes during a semester. and only 4 classes during a semester. So they would take the same 4 classes every day throughout one half of the year, and that at the half year point, they would switch and go to another set of 4 classes. I would say in general, it's we always want to consider all ideas and never dismiss any idea, but it is in our best interest during this time to make as few substantive changes to the schedule as possible, because we do want to be able to pivot back to a full brick and mortar 100% student attendance environment. And we do want to offer children the opportunity to take the classes that they signed up for this past winter and spring, and provide them a full portfolio of the elective options that they had requested. And candidly, a 4x4 schedule just doesn't accommodate for that. So to be abundantly clear, I will say that we are not considering a 4x4 schedule at this time. Because of our ability to be able to pivot back and forth between virtual, blended, or hybrid, and the full brick and mortar setting the way that we would like to.
Thank you, Dr. Taylor. Dr. Pope, Ryan has asked if we're looking at changing the school calendar at all to accommodate if we're not going to be able to have children in every day. And I'm guessing there's some contractual and potentially budgetary issues with that. So what plans would we have to make sure all the required curriculum gets delivered?
So love the calendar questions, Mr. Bullis. I feel like we've spent a lot of time with our new board already since they've taken their positions in our calendars. And one of the things I just want to take a moment here to be able to say to everyone is that we have our approved calendars for this year and for the next school year. So for 2021 and 21-22. And those are posted on our website for any families that, for planning purposes, are looking that far ahead. We do know this year, and just as a reminder to those folks out there listening, that our 2 year-round elementary schools, Falling Creek and Bellwood, will for this year only revert to the traditional calendar. So all of our students in Chesterfield will begin on September 8th this school year. To the question of curriculum, I will say that we all recognize that we had lost learning for all of our students in the spring of 2020. One of the things that the curriculum office is doing, well, the first thing that we've already done was immediately identify those SOL strands that we missed in the spring. And then we looked at those strands from the context of how many of those learning strands, the knowledge and skills that should have been covered in the spring, are essential for learning moving forward. How many of them provide foundational knowledge and skills that students must have to be successful in the upcoming curriculum this year and for the rest of their educational journey. We call those the power strands. And often in our Virginia Standards of Learning, those strands do repeat or come back more extensively in the following year's curriculum. So we're looking at those power strands, ensuring that they're woven in, embedded in a sensible way into this year's curriculum and even into the next year's curriculum. We've said to this board repeatedly, and it's been in many of our public presentations, that we are considering the makeup of that lost learning as a marathon, not a sprint. And so that marathon work will begin this fall on September 8th.
Thank you. Dr. Pope, let me stay with you for 1 second and help explain some of the professional development that we're offering to staff. Laura has asked, are we being very clear about our expectations with teachers who will be teaching virtually? It cannot look like it did this spring. What are we offering staff this summer that will prepare them to deliver instruction in the fall?
So I will put a huge exclamation point on every parent who is in our community right now thinking that very thought. It cannot look this fall the way it did this past spring. We are in 100% agreement, and it's very rare today that we are all in agreement on one thing. We were thrust into a virtual learning situation. Our teachers, I think, did an amazing job considering it was nothing that they had truly been prepared for or expected. But we know, and we have to be honest, that not every student this past spring had the same learning experience. And we've talked a lot with this board about equity and opportunity and access. And we have to ensure this coming fall that every student has the highest quality educational experience. And that ends with not only providing the devices and ensuring the connectivity for our students who are learning virtually, but it also starts with our teachers. In fairness to them, we need to be sure that our teachers are prepared. And we have already created internally many professional development opportunities. And it's one thing to offer a professional development opportunity, but teachers have to sign up and participate in that learning. And we are all continuous learners, and we all need to continue learning. And I have been overwhelmingly pleased with the number of teachers who, even in April and May, were signing up for these new professional development opportunities to better prepare them for the challenges they were facing. So I think it was in May, we saw thousands of teachers already register for professional development in the spring and leading into this summer. Very specifically, in preparation for this coming fall, we know that our parents are overwhelmed when teachers select their own modes of communication and instructional delivery, because a parent with one child may have up to 7 teachers, and then with multiple children, just keep multiplying that out. And with teachers using a variety of ways to send information, it can be very overwhelming. So we are expecting all of our teachers in the fall to use our single learning management system called Canvas. We're going into the 3rd year of Canvas, and to be sure that all of our teachers are well versed in the basics of Canvas. They are all required to complete a professional development, and not only complete a professional development, but actually pass mastery checks. Maybe another way to say that would be little quizzes, to just be sure that they are on point with basic skills that every teacher will need to have, so that all students and all parents can operate through that single medium called Canvas. In addition to that training, which is a requirement, we also have trainings for our secondary teachers on Edgenuity and for our elementary teachers on our newest product that we're providing called Lexia, which really will help build literacy skills from our pre-kindergarten, kindergarten through 5th grade teachers. We did not have those tools available this past spring, and they are foundational pieces to a good virtual learning plan moving forward. Because whether we're virtual 100%, whether some parents are choosing virtual, some are choosing hybrid, or whether we're back in our building as we would consider the new normal, these tools are just good instructional tools, and they will help teachers do a better job. They will help personalize instruction, and our teachers are all required to be checked off in their competencies in these products and in this medium. And then the final thing I'll add is that we've tried to do a 2-for-1. As teachers are learning or refreshing their Canvas skills, we have embedded the best practices for great distance teaching and learning. So in other words, distance learning pedagogy. So teachers are getting all of that as a refresher or as a first time for some who maybe never had that in their initial college experience.
Thank you, Dr. Pope. I'm going to do a time check real quick. We have a little more than 20 minutes left in this session this morning. A quick reminder to those of us on the presentation right now that were not with us when we started. These have been taped and are being taped and will be put on mychesterfieldschools.com, our school division's website. They'll also be available in their full entirety on YouTube and social media, Facebook as well. So if you missed something or want to go back and look, you didn't think you heard an answer right, or maybe you didn't hear the answer, please feel free to go back and look at those. Dr. High, the next 2 questions about the schedules will come to you. Chris has asked if we've considered stretching K through 5 across all of our schools and having students in grades 6 through 12 learn online at home.
So yeah, that is something that we have considered and had numerous conversations about. One of the challenges, or a few of the challenges that we face, is first of all staffing. Being able to move kids across the division into our 64 schools would be a challenge in terms of having the adults in the buildings, as well as the endorsement areas that they need to teach in. Elementary teachers are endorsed K-5. Our secondary teachers are typically endorsed in content areas. So we need to make sure that we have the right teachers teaching the students. The second challenge is the classroom spaces. The middle and high school classrooms aren't set up for our youngest students, our kindergarten through fifth grade students. And the materials and the way that the chairs and tables just aren't in configurations that we would need, nor would we have enough of those in the division, even if we attempted to move them to the other schools. So that's why we have not continued to consider that as an option.
Okay, thank you, Dr. High. Wendy wants to know, did we or would we consider a week on, week off option for students where all students are in for 4 or 5 straight days the first week and then at home for 4 or 5 straight days the next week? She seems to think that might be just as easy for parents who need childcare purpose.
I do believe that was an option that we considered a couple of weeks ago. We moved from that because we were hearing from community and other staff members who were concerned that that length of time away from a teacher might create just as many concerns that families are having when they're not in full time.
Thank you, Dr. High. I guess it just goes to reiterate that there isn't a solution that's 100% perfect for everybody at this time. Next question goes to Dr. Taylor, who's been working with our budget team on this. Carrie's asked what additional staff has been hired to support our efforts as we return to school.
Well, thank you, Carrie. That's a great question. You may recall earlier this year, the school board adopted the most aggressive budget in Chesterfield County Public Schools history. At nearly $750 million, we are one of the largest entities in the Richmond area. We are closer in size to a Fortune 500 company than we are to a lot of school districts in Virginia. And one of the major components of this past year's budget was a huge increase in staff, not just to manage the over 1,000 students worth of growth that we get year over year, but also to backfill some of the lost staff since the Great Recession back in 2008, 2009. Some of the features of that budget included 100 new staff members for special education positions, 60 counselors to be added to the school system, and about 40 new ESL teachers. Unfortunately, about 6 weeks after the board adopted their landmark budget, COVID hit, and we received updated revenue projections from both the state and our local government, and the board was confronted with a $23 million reduction in their big budget. So from that operating budget, they peeled out all of the right stuff. They took a hard look at their base budget, made some tough decisions, reduced some centralized positions, and eliminated all discretionary funding and tried to preserve as much staff as humanly possible. Unfortunately, counselors and ESL teachers were some of the things that the state cut out of their portion of the budget, and we did as well from our operating budget. But what we discovered as we got into May and June is that through federal stimulus money in the CARES Act, we were able to restore those positions back into the budget. Normally you would never want to take stimulus money and support an operating expense with one-time cash. But in this case, we have reason to believe that we will be able to support these positions in perpetuity, whether they be added back into the biennial budget or not. And we have been able to adjust and to keep these positions in our operating budget for this year. So what this will mean is that students, when they return, will come to a full complement of ESL teachers and a full complement of counselors that were otherwise previously cut. And that's about an equivalent, and it's not precisely this way, but it's an equivalent of around one additional counselor per school building on average throughout the school division, which is pretty exciting and pretty necessary. Referring back to a comment that I made earlier in the town hall about us focusing on Maslow's before Bloom's, this is definitely in line with that philosophy that we take care of the needs of the whole child first before we focus on the instructional needs of our children. So with that, we're pretty excited that we've been able to adjust for that. Something that we're working on right now in order to gear up for the fall is to make sure that we have a nurse in every school building, a registered nurse. Presently, right now, we do not have a nurse in every single building. We do in most of our buildings and in all of our large buildings. So we are readjusting some of our base budget to accommodate for that so that we can make sure we're meeting students' physical health needs as well as their social emotional needs.
Thank you, Dr. Taylor. We're coming up with about 15 minutes left, and I do want to leave time for Ms. Heffron and Ms. Coker to make sure that we've covered the questions that they're hearing most often for their constituents. So I've got 3 questions left. I'll probably take the last 2, so I'll go to Dr. High for the first one. Dr. High, parents want to know what we're going to be doing with their extracurricular activities and courses such as band, chorus, and CTE, the career and technical education courses. They view them as a critical component to this.
So our goal with our schedules is to create schedules that are as similar to the current complement of classes and courses that students have been able to take. So our goal is to, as much to every extent possible, to continue to have the extracurricular courses or art courses and performing arts, as well as we're looking for CTE and our specialty programs to continue to offer those. The one good thing about our CTE courses is when they come to CTC, they're smaller courses, so we're able to complement and allow for some of that hands-on instruction that we know needs to happen for these students to be able to access courses like cosmetology and culinary skills and all that. So our goal is to, as much as we can, to keep the schedules and allow students to be able to take the courses that they've signed up for and keep them on pace and on track for their next grade level as well as graduation.
Thank you, Dr. High. Another question that came in that I'll tackle very quickly is when will we expect to see fall athletics return? And we're actually waiting, along with other school divisions across the state, for some guidance from the Virginia High School League, which is the regulatory agency that all high schools in Virginia associate themselves with. They met earlier at the end of June and decided they were going to wait at least another month before they made a decision. It could be as long as 2 months. That said, we do anticipate the possibility of starting some summer training within the next 2 to 4 weeks. We'll be submitting plans to the Virginia Department of Health to make sure that we're aligned with best practices there. So another key component to an overall well-rounded education. The last 3 pieces that I'll throw out, and I'll ask Dr. Taylor for help for this one. We had a question about whether or not we're working or at least communicating with surrounding school divisions so that we're aware of each other's plans. Some school divisions are looking at some of the same options we are, smaller school divisions. Some of them that are around the Bermuda district are looking at bringing in more students than we are because they have smaller class sizes. How is that work going?
Well, I think our families can be very proud of Chesterfield County Public Schools in a number of fronts. One front that they can be very proud of is that we are genuinely interested in engaging with our families to hear what they think about this issue. That's why we are having 9 town hall meetings, doing multiple surveys, and we'll continue to engage as the landscape evolves. We speak daily with our counterparts in neighboring school systems. This has been a great relationship that we have with our neighboring school systems in terms of developing calendars, developing common and regional expectations on a number of fronts. Ultimately, this is going to come down to different localities and their individual school boards and what they feel is best for their communities. It would be great if we had some regional continuity. We all support that idea in principle, but we also know that each of our communities has some unique qualities, and the school boards will have to individually weigh those unique qualities against recommendations that they see from their respective division staffs. In that light, I will add that as the largest school system in the Metro Richmond area, we are a leader, and folks are waiting to see what Chesterfield does. There's a lot of folks that would say, as goes Chesterfield, so goes the Metro Richmond area, or as we commonly refer to them as Region 1 of the state's superintendent study groups. And we will make our recommendation to the school board and make that tied to the phases that are released by the governor's office. And we'll take it one step at a time, as I know our regional counterparts are doing the same.
Thank you, Dr. Taylor. I appreciate you mentioning the feedback in the 9 town halls again. The last 2 questions really have to do with engagement. Kayla on our YouTube channel asked about how can parents provide feedback, and that's exactly what you're doing today. Over the 7 sessions now that we've offered so far, we've had viewership that's ranged between 10,000 and 20,000 viewers on the 3 different platforms that we're offering this. That's our website, Facebook, and YouTube. And if you go back and read, which we are doing, all of the comments that are included in the social chat functions, we're averaging between 500 and 1,200 comments, questions, suggestions. Those are all being stripped down and will be prepared and presented to the school board. So they'll have the opportunity to review everything that all of the residents have written. Kara asked also, what are we doing to engage our Spanish-speaking community? And that's a great question, because we want to make sure that all of our families are reached in this regard. We were happy to share that we worked yesterday with a county colleague, and that we'll be working next week on the Spanish-speaking, the Hispanic radio station that serves Chesterfield County, to provide this presentation and do a Q&A with that as well. So we want to make sure that we're engaging everybody moving forward with that regard. And so with that, we've got a little less than 10 minutes left. Based on what you've heard today and where we're going next, open the door to Ms. Heffron and Ms. Coker. And I'll go to Ms. Heffron first, because I think Ms. Coker is going to work to close us out.
Thanks, Tim. Yeah, this has been, as I mentioned at the start of this has been a really, a very productive town hall and series. And I thank all of you on the central office team for pulling this together, and for, I think those numbers that you mentioned, Tim, really speak to how engaged our community is. And this has been, we have a lot of information to digest, but we also know that we have some time for, the situation is always moving. We've heard our constituents, and I certainly appreciate everyone who took the time to plug in and to be engaged and a part of this process. Anne?
Yes, thank you to CCPS staff and to all the behind-the-scenes technology staff that put together these 9 town halls this week. It was quite an undertaking, but I'm very glad that we were able to do this, because it's very important that we continue to get your feedback. To the viewers, Dot and I thank you very much for attending today and attending all the town halls that we've had thus far. We do hope that you have found them helpful and very informative. You have provided great feedback and questions and comments. And as our number one goal is to listen to the community, and we appreciate your questions, it is very valuable to us. We understand that the situation is not good for anyone. But as a school board, I do want to share a little fact that we have 15 kids in CCPS. So we are right there with you. We understand the difficulties that parents are facing, and we are too facing those same challenges. But as a school board, we have to step back and we have to look at what the best decision is for our students, our staff, and for our parents. We want to get back to a normal school setting just as soon as we possibly can, but we got to take the steps today in order to make sure that we can return normal sooner rather than later. I wish there was a clear and easy answer to the situation, but we are going to examine all of the information that we've been given and make sure that we return our children to a safe environment and a safe education. We'll continue to make adjustments and make sure that we mitigate the educational gaps and that we work together to return to learning as soon as possible. Please continue to share with your friends and family and neighbors that we have 2 more town halls today. And also make sure that you go back and listen, as Tim mentioned, to previous town halls if you aren't able to join today. And over the next few months, watch out for the website, Facebook, and YouTube for additional announcements and information as we pull this together. And once again, thank you for your participation, and I hope everyone has a great day.
Thank you, Ms. Heffron. Thank you, Ms. Coker. I want to draw this to a complete full circle from where we started earlier this morning, and we started about grace and patience, and we sincerely appreciate that from the audience that we've had today. I think we all realize that not one of us on this who is participating today, and there's been several thousand at this point between the 3 platforms, is to blame for this, and we've all got to pull together to work for the best options. And there is not one option that's 100% in favor of everybody. So we will not make everybody happy with this, but we're going to do everything that we can to do what's in the best interest of our students and our staff and our families in a safe manner. The last 2 things that we need to point out is there's 2 groups that we really need to thank before we close out today, because the past 3 months have not been what anybody signed up for. We need to thank our teachers for the Herculean effort that they've undertaken over the last 3 months. None of them signed up to teach from home, to teach students who were at home. They all crave that face-to-face interaction and the relationship that they build with that student and watching that student grow in the classroom. To have them turn on a dime, we say all the time it's very difficult for a battleship to turn on a dime, but our teachers did exactly that. And we appreciate the support that they've put out. Along those lines, we couldn't have done this without parents either. Parents have many other responsibilities to do other than educating their children, yet our parents were very gracious in picking up that new role as teacher at home, and we sincerely appreciate your willingness to join us in this partnership. That partnership continues over the course of the next several months as we make a decision, as the school board makes a decision at the end of July, and then we continue to monitor to make sure that that decision will be applicable when we start school. So there's still a lot of conversation left to have, but we appreciate you joining us here today. Thank you for your continued support of Chesterfield County Public Schools. Have a great morning.